Medicine or drug spending is one of the major health or medical care expenditures that require efficient management, especially for high-cost medicines that are essential for the patients. Establishing a mechanism for accessing good quality drugs is regarded as a challenge for the Thai public health system in terms of drug prices and qualities, so that the patients will have access to quality medicines in a most cost-effective manner. Management of high-cost, essential medicines in the Universal Health Coverage UHC context. Faculty of Medicine, Ramathibodi Hospital. Having access to essential medicines is one of the factors in assessing medical services, especially the medicines in Category E2 in the National List of Essential Medicines, NLEM, which are very costly, but essential for specific individual patients. The Subcommittee for Development of National List of Essential Medicines is responsible for revising and improving the list of essential medicines for use in the National Health Security System, under which the Health Economics Working Group, HEWG, takes charge of establishing the criteria for cost-effective analysis and conducting analyses of cost-effectiveness, as well as budgetary impacts on the list of medicines to be submitted for inclusion in the National List of Essential Medicines for consideration of the subcommittee. The main concept for decision-making on including any medicine into the National List of Essential Medicines is the evidence that the medicine has been technically proven to be really effective and safe, and its use does not cause any financial burden for the country. Ramathibodi Hospital and Medical School, officially under the Faculty of Medicine, Ramathibodi Hospital at Mahidol University, provides medical services for the patients, teach medical and nursing students, and conduct research studies. Here is an example of government hospitals that use the system for the management of high-cost, essential medicines under the Universal Health Coverage UHC scheme, or Universal Coverage Scheme, UCS. Viriya, a girl patient who has had ascites, or accumulation of fluid in the abdominal cavity, since she was 9 months old, and is unable to live a normal life like other normal children. The doctor in Phetchabun province, her hometown about 400 kilometers north of Bangkok, suggested that her parents take her to get medical treatment in Bangkok. The doctor at Ramathibodi Hospital diagnosed Viriya with severe Gaucher's disease, a genetic disorder which may have neurological symptoms in the future and finally die unless proper and timely treatment is provided. The doctor treated her with drug imiglucerase, an enzyme-type medication in the E2 category of high-cost medicines, for symptomatic care prior to undergoing stem cell transplantation. The grandmother said, "When the doctor said this medicine would cost millions, I had no idea what to do next. Our hope flew away. It brought so much worry to our family. But the doctor was so kind. She told us that she would try to find a way to help us." Professor Duangruti Watanasiri Chaikun, MD, Division of Medical Genetics, Department of Pediatrics, Faculty of Medicine, Ramathibodi Hospital, Mahidol University, said, "The problem in dealing with this disease is that the society and general public normally think that the number of patients is rather small, but actually the number will be larger if all cases of rare diseases are added up. So their significance is not different from other chronic diseases such as diabetes and hypertension." Studies on the treatment of patients with clinical symptoms of type 1 and type 3 Gaucher disease with imiglucerase have shown that the enzyme can help reduce the size of the enlarged spleen to the regular size, and it can also extend the patient's lives and enhance their quality of life, especially pediatric patients. The treatment is required for preparing the patient's body to be ready for stem cell transplantation, which is a cure for the patient. In administering imiglucerase, consideration must be given to the fact that the enzyme cannot prevent or treat neurological and brain symptoms that might occur later on in type 3 Gaucher patients. Studies in Thailand have revealed that even though most pediatric patients' symptoms are like those of type 1, their genetic tests have indicated that they are of type 3, which might show brain symptoms at a later date. Thus, to effectively treat type 3 Gaucher disease, the enzyme has to be given and then rapidly followed by stem cell transplantation before the brain symptoms begin. Stem cell transplantation for Gaucher patients has been included in the benefit package under the UHC scheme. The patient has to receive enzyme imiglucerase before undergoing stem cell transplantation so as to increase the success rate and reduce complications and deaths due to transplantation. This design of treatment will cut the cost of lifelong medication and is suitable for the disease spectrum of Thai patients. Viriya has already undergone stem cell transplantation and hopes to live a normal life and go to school like other normal children. Professor Suradet Hong Ing, MD, Chief of Pediatric Hematology, Oncology, and Bone Marrow Transplantation. Thailand has many great physicians who have been well trained from overseas. However, the knowledge from their learning is not always applicable for every situation. Applying research evidence and introducing innovation of treatment, which are appropriate to the Thai context, will help our country to decrease burden from high-cost medicines and save the lives of patients without country's bankruptcy. In the past, the steps for prescribing and approving the use of high-cost medicines in Category E2 medicines were complicated and difficult for the doctors to fill out required documents. So, Ramathibodi Hospital has integrated the knowledge and research findings to minimize obstacles and support the policy on the provision of high-cost treatment, aiming to make it convenient for doctors and pharmacists in the administration of Category E2 medicines in the National List of Essential Medicines, and laid down the following guidance. The doctor fills in the drug administration form. The pharmacist checks the drug administration form and the prescription, fills in additional information, and dispenses the drug to the patient. The pharmacist sends the information to the Health Insurance and Social Security Unit to request the drug from the fund. The government pharmaceutical organization delivers the drug to the hospital through the Vendor-Managed Inventory (VMI) system. The officials from the hospital and the National Health Security Office conduct the post-audit of the information on drug request. Dr. Narongrit Masaya Anon, Deputy Director, Ramathibodi Hospital, Faculty of Medicine, Ramathibodi Hospital, Mahidol University, said, Thailand's system for the management of high-cost medicines in Category E2 is very useful for patients. The system was established not only by any particular sector, but through multi-sectoral coordination, especially the Subcommittee for Development of National List of Essential Medicines, which has seen the benefits of including high-cost medicines in the national list. The financial management with a limited budget has to be undertaken for the maximum benefits of the patients to ensure efficiency as well as cost effectiveness in government budget spending. The management of high-cost medicines also involves the negotiation of drug prices, which can save nearly 10,000 million baht annually of the drug budget from the National Health Security Fund. In addition, the system has helped cut the spending on high-cost medicines for the hospitals that have to provide curative care for the patients who need such medications. The case study has shown that the management system is necessary for ensuring the rational use of medicines, especially high-cost ones, and the equitable access to such drugs.